Our innovation is a service supported by an app and a website, so there is a bit of digital techie stuff there. It's Escape Pain. It's for people who have chronic hip, knee and back pain. And it does what it says on the tin. It helps people self-manage and cope with their arthritic pain using exercise as a self-management strategy. Why? There are 10 million people in this country with chronic joint pain. The impact on them and society is enormous here. It's getting worse because we're doing less and less of everything apart from eating more and more. And we know that inactivity and being overweight are important risk factors for developing joint pain. So by the next decade or so, this problem is going to double. So we devised Escape Pain, which is an integrated rehabilitation programme for people. They come up and attend twice a week for 6 weeks, and in each of those sessions they get simple information about their problems and how they can cope with it. And also we lead them through a guided exercise programme, so they start to learn that activity, rather than something to be feared, actually can start to help them. It's safe and they don't need an expensive physiotherapy to do this. And they work in groups of 10, so they form great relationships with each other. We have a wealth of information to show that our programme is safe, effective, reduce healthcare costs. It's cost effective, the people love it, it has sustained benefits, and it can avoid surgery. And the last person you should believe when they say that is an academic who's talking about their own work. So we have lots of independent assessments out there to show that it is the most effective programme of its kind. For each pound you spend, you get £5 return, and it's easily implementable. So that's what we've done over the past 4 years, working with the Health Innovation Network, South London's AHSN, to spread this programme. We did it by getting it endorsed by influential people, particularly recently the NHS Accelerator. We've developed a website where people can go and see what the programme's about. We have an app which is nice but can be refined a bit more so that people can use it as a complement very often to the programme, if not on its own. And we've got a wealth of support that we work with people to say, if you want to implement this programme, this is what you need to know, this is how you need to recruit people, this is what you need to do to raise awareness to it, and we can work with you to show your commissioners how you will save money locally. And we've started off in London and the southwest, so you can see there is lots of activity down there, but we are getting more and more interest and inquiries from the frozen north here. Yorkshire is a bit devoid, so come on lads, join in fun. We would love to be able to help you, and I don't want to drag all the information back, so please take some from our stand. I'm not bringing it back to London. We would love to be up here in Yorkshire. We are currently in 50 clinical centres and increasing rapidly. 5,000 people have gone through it, which we estimate has saved about £5 million. But we have a problem. We have very limited resources and enormous population trying to access those resources. So we know we need to get outside the NHS. Recently, we've got funding from Sports England to say, can we spread this programme through leisure centres, and not just leisure centres, community centres that are deep in the community. We put out a call, we were inundated with requests, we got 70 expressions of interest, that turned into 35 full applications, and we're spending 3 days going through those, interviewing people. It's been absolutely phenomenal and very, very interesting what is happening out there and how they see that our programme can fit in. If we can get this spread wider, the impact is potentially huge on people, and we must never forget that those are the most important part of this. We can improve their general health, their physical, their mental comorbidities, and we can save enormous amounts of money for the NHS. We probably won't be able to get to the 4.1 million people who need and deserve this, but if we can get to a manageable lower number, even 10%, you can see that we are saving enormous amounts of money for the NHS. There are so many people out there. This is such an expensive problem. It has to be addressed, and this is one way of doing it.